Hello, my name is Dr. Catherine Clifford and I want to speak with you today about COVID-19. It's important you know that the virus is in every county in Ireland, and so no matter where you live, you won't be far from a positive case. There is a lot of information online about the virus and some of it is not accurate, so I want to make sure you're getting the right information. So the virus can only enter your body through your mouth, your nose or your eyes. This can happen in one of three ways. Firstly, you can become infected if someone coughs, sneezes or breathes too closely to you. This is why we're being told to stay at least 2 meters apart from people, other than those we live with. The second way is that you could touch something which has the virus on it and then touch your nose, mouth or eyes. It's so important then that you wash your hands often and always before you touch your face or eat. You should wash your hands immediately when you return home from shopping or work. Keep those hands as clean as you can. And thirdly, you could catch the virus by using cups, glasses, plates or cutlery which were previously used by someone who has the virus. Please, where possible, do not share these things, and if you have to, make sure you wash them thoroughly beforehand. Now this is a very important bit. It's not always obvious who has the virus and who hasn't. Some people who are infected with COVID-19 feel and look completely fine and won't be displaying any symptoms, but they can be passing the virus to others without realising it. That's why it's so important we stay 2 meters apart from others outside our homes. I know that can be difficult. Some people live in places where there are lots of other residents. Some of you work in places where keeping a distance from others is very difficult. But please keep trying to adhere to the guidelines as much as you can. It is now recommended that you wear a face covering if you are living or working somewhere where it is very difficult to keep a 2 meter distance from others. By the way, 2 meters is the same as 6 feet. Now, if you do develop a cough, fever, sore throat or have difficulty breathing, then you should arrange to telephone a GP to arrange a test. Even if you're not already registered with a GP, any GP will talk to you on the phone and arrange a test, and this is all available for free. For some, including asylum seekers and refugees, the process may be different where you are staying, but you will also be tested if you have symptoms. The testing, which will take place at a local centre, is quick. A cotton swab is put into your nose and then into your mouth for a few seconds. It's a little uncomfortable, but it's really not painful and it is completely safe. Now, most people, especially children and those aged under 60 who test positive for COVID-19 will have a mild illness and recover in 1 or 2 weeks. Some people may not have any symptoms at all, despite having the virus. You must self-isolate until the virus has passed. This means staying away from everyone else and not leaving your home for any reason for 14 days. It's difficult, but this is to stop you spreading the virus to other people. If you or a loved one has difficulty breathing while you have the virus, you must contact a doctor immediately and you may need to go to hospital. Remember though, most people will recover and we will all get through this, but only if we follow the advice of the medical experts. Once you or anyone else has recovered from COVID-19, you cannot infect somebody else. There should be no stigma to catching the virus. People from all different backgrounds, nationalities and walks of life have contracted COVID-19 around the world. So, I repeat, there is no need to be afraid of someone who has recovered from COVID-19. We will keep you updated with videos, and if you have any questions, you can email us. Look after yourselves and your families. Please share this video message with other people who speak English. And remember, to protect yourself, you must also protect others.